I think we have a really exciting topic to talk to you about today, which is maternal health programs in Morocco. So just for a quick introduction, my name is Angela Baker. I run the wireless reach at QualComm. QualComm, of course, is one of the world's leading mobile technology companies. And wireless reach is a strategic corporate responsibility program that looks at how we can leverage mobile for economic and social impact in the areas of education, health, entrepreneurship. So we're looking at, really how we can help some of these SDG goals that governments around the globe are trying to achieve. And this is Osa.
Hi, everyone. Thanks for having me here. My name is Asa Nordgren. I'm the CEO and co-founder of Trice Imaging. And we have a cloud platform for remote diagnostics. Pretty much you connect any imaging scanner, ultrasound, MRI, CT, to the cloud so that you can scan in one location and get the diagnosis done in another location. We have users all the way from Mount Sinai here in New York to rural Morocco, and we're here to talk about the project that we have in Morocco, and thanks for having us.
So I just want to say, last night we were demoing a new virtual reality video that we have that is actually about this program in Morocco. So if you were at the reception last night, you might have seen it. If not, the VR video will be available all day today at the SocialGood Summit, and I encourage you to check it out. We work with a really cool New York company called TEM that cut that video for us. So just to give you a little bit more information about QualComm Wireless Reach. So as I said, we're a strategic corporate responsibility program. We're celebrating our 10th anniversary this year. QualComm is a company that's really looking at sustainability issues and corporate responsibility and taking it seriously. And in 10 years, we've reached 10 million people through the use of mobile. We've worked with 650 partner organizations. We've got 114 programs in 46 countries. And one of those programs is this Morocco program, which was a private-private-public partnership. And I think that's why it really set it up for success. What we did is a few years ago, we went into Morocco working with Trice and the local government there and Sony to take mobile ultrasounds. We looked at this challenge of 800 women globally die every day from complications related to pregnancy that are, for the most part, pretty preventable. And we went into an area of Morocco where it's pretty rural. There are lots of women there who have never had access to an ultrasound. And we saw some really great results. So we ran an 8-week trial with Trice Imaging, and we found that because we were using mobile as opposed to printing out images, so the images are transmitted over the 3G network, the diagnostic review time was shortened from 2 weeks to less than 24 hours. So people were able to scan the ultrasound and then send it for a second opinion, whether that was in Rabat, which is, of course, capital Morocco, or it could have been to France, could have been to China, could have been to US, to anywhere. We were able to lower the cost from $80 to under $2. And we saw an increase of skills for people who were able to, the trainings that were happening to learn how to take these ultrasounds and to read ultrasounds. But even more importantly, I think, is we saw an increase of the number of women that were going to visit health houses to deliver babies as opposed to delivering them at their homes, which allowed them to get the care that they needed. So it was actually quite interesting. And if you saw the video yesterday, you saw we're going into some really rural areas of Morocco. The doctor's able to take the ultrasound machine with them, whether they go to the clinic or they can take it into these houses that have no electricity. They're not connected, not on the grid per se. And so it's really quite amazing. So Osa, I'd love to ask you a question. We sort of decided jointly to work in Morocco, but what was unique about working in Morocco? Why was it sort of a good environment for this type of program?
Well, we wanted to make a point that high-quality diagnostics and ultrasounds should be available everywhere on the planet. So we picked Morocco. We found 3 really beautiful villages up in the Atlas Mountains, 4,000 feet above sea level, super cold. They have something they call health houses, which is pretty much just a facility that is used as a hospital. They had no running water in the labor and delivery room. Electricity was coming on and off, but it was still accessible. It's a couple of hours outside of Rabat and Fez, so it's accessible. It's in the intersection between Europe, Africa, and the Middle East, so it was actually a really good location to work in. And the people are absolutely fantastic.
And I think, I mentioned earlier that the government, so because we had this program, we only ran it jointly for a year together, and then Trice and the government sort of took it and ran with it. And because of the successes and some of those results that I named, the government of Morocco has actually picked this up and they're running with it. So can you talk a little bit about that? Because we just actually signed the final contract this week about 2 or 3 years in the making. But we got there. So can you talk a little bit about how that's scaling and what the potential is globally for programs like this?
Okay, so the government of Morocco decided to roll this program out nationally. So the first region that is taking it up is the region of Rabat. They have about 10 health houses there where this will be rolled out. And then from there, we will grow it and scale it into the next communities. The technology as such is so simple to use. Pretty much it takes a couple of hours to learn how to use the ultrasound scanner. The rest of it is self-explanatory. So basically, we use a trainer-trainer approach. So the local community health workers in one location teach the next location that teach the next location. The people that use the technology in this project have never used an ultrasound scanner before. And they got a couple of hours of training, and then they self-trained. And we managed to get the quality up from 10% of the images being good enough quality for diagnosed to 92%. So it's kind of a train-the-trainer approach, and the fact that the technology is so easy to use, it's absolutely crucial for it to spread. And if you look at it from an international perspective, I bet we could save a couple of 100,000 women's life every year. And a lot of families could actually have a mom going forward. Children could grow up with 2 parents. And I think that is a pretty fantastic opportunity.
I think that's really important. So when we were just in Morocco a few weeks ago filming the virtual reality and visiting some of the program beneficiaries. And the woman that's in the video, if you were able to see it, her name is Fatima. And she said that, she has known a lot of women or some women in her villages that unfortunately were not able to get the care they needed and passed away because of not having access to this. So this is her second child that she's pregnant with right now. She did not have an ultrasound for the first one, and she said it was really amazing to be able, again, the doctor came to her home, she was able to see her baby, to find out that everything was healthy and progressing the way that it should be. And I think that's not, we don't want to overstate that, but that's really important, for peace of mind for the mother. So I think that's something that's really amazing about this technology. But Osa, I wonder if you could go a little bit more into the tech and just talk about your platform that you and your team have created and how that works, how it's encrypted, and the fact that the images are transmitted over the 3G network.
Okay, so the core technology here is a cloud-based platform where you can upload any type of imaging, any type of report, so that it can be accessed and reviewed remotely. Basically, what you do is that you connect the scanner via tiny encryption software to the cloud. And then you transmit directly from the ultrasound scanner, which means that you don't have to have a PC or anything. You transmit it directly from the scanner to the cloud, and the clinician on the other side get a text message with a ping saying you have an image set or a fetal ultrasound that you had to review. And the reviewer on the other side can open this on any cell phone, tablet, PC, whatever, go in, review the images, and communicate back to the clinician in real time, which means that they can let the mom, in this case, know while she's still with the physician. It works with any type of imaging modality, and you can review on anything that has a browser.
Yeah, I think it was in the video you can see, so there's a doctor in the clinic who's able to receive the messages or the images and report a second opinion back on that. So it's really interesting to see how it's working. As I said before, QualComm Wireless Reach, we work, we've got over 100 programs, and we often work with local implementing partners or local partners. So in this case, we partnered with Trice on this. They had a woman who was going into Morocco often, but also I think the key part was that we were working with the local government. Because again, if you're going in, working on healthcare issues and working in local health clinics, if you don't work with the local government, it's not going to be sustainable or scalable. So I think that was really important, and we were really honored to have the partnership of the government because they were so willing to scale it. So as I said last week or 2 weeks ago when we were there, they just got the 31 signatures needed to scale this program, so we'll be able to roll it out. It means they added a line item to their budget, which if anyone's worked in government, they know how difficult that is. Can you talk a little bit about what's next for ultrasounds and what's next for Trice specifically?
Well, what I think is interesting is the fact that ultrasound machines or any imaging modality, they're like refrigerator-sized big machines, and they cost $180,000 a pop, right? But what's happening is that these devices are shrinking. They're becoming smaller and fit inside of the pocket of someone that could travel with it. They also become connected. The networks now are so good that we can send image files from any location to any other location, which means that it's totally possible to scan in one place and review in another place. So the next generation scanners, they will have our system built into them. So pretty much like you buy a cell phone nowadays, it comes with a SIM card inside. You don't necessarily even know that there's something in there. It comes with a data plan. So when you purchase a scanner, you just connect it to the wall or connect it to the cloud, and then you can transmit the studies and get a remote diagnostics done. So the medical device industry is sort of copying or following after the mobile world.
Yeah, and I think, you know, in Morocco, when we did this trial, it was a clinical trial, we had IRB and everything in place, and we did it with 600 women, so 600 patients that came through. We had a little over, I think, 140 that needed to get a second opinion based on what the doctor saw on the ultrasound. But because of that small trial, again, we ran it in 1 year, it's taken a lot of time, you know, specifically from the local implementing partner side, but we were able to scale it. So I think these types of programs that are, you can call them pilots, I know that word's sort of a bad word now in terms of people get that mobile works, but running these types of programs with you know, local communities and partners is really important to show that this is working and that we can use mobile for almost all of these sustainable development goals. You know, we sort of look at it through the lens of Goal 9, that we're trying to help grow industry and infrastructure and innovation, but really, you know, it can you know, help with healthcare, it can help with education, gender equality, and at QualComm we're really doing a number of programs around those issue areas. So we have a little over 3 minutes left, and I'd like to open it up for questions. If anybody has any questions specifically on the Morocco program or more broadly on the use of mobile for the SDGs.
Please.
And I know y'all have been here a while, but no question? Yeah.
I may have not have gotten all of it, but when you're talking about VR, how accessible is it to have units on all sides? Maybe you addressed it.
To have units on all sides for virtual reality?
Yeah. In other words, for people actually use it in the field.
So we're using it right now. This is sort of a new technology. No, it's totally great. We're using it right now as a PR tool, basically to show people, to have them have this immersive experience where they can go in and see how these programs are working. So we're not actually using the VR in this program as a way for people to read ultrasounds, although there certainly could be applications for that. And QualComm is rolling out, we've just rolled out a new virtual reality. I think it's going to be on the market in December. But so we haven't gotten that far yet, but I definitely could see applications for that. And I think the technology is becoming so inexpensive, right? You can get the headsets for fairly cheap. You can use it on any mobile device that you have. Mobile's obviously becoming more ubiquitous. So maybe at next year SocialGood we can talk about that.
Can I also comment? I think you're onto something that is super important. And the fact that the technology needs to be adaptable to the locations that you go, where you're open to provide it, right? So for this specific program, the only thing you need is an ultrasound scanner. We can use whatever you have already, or you can purchase a cheap, affordable, portable one to use. And on the other side of the equation, where you do the reviewing, you can anything with a browser. We're not asking anyone to buy any specific equipment. So I think that's a very valid question. The technology needs to be able to operate into the context.
And be able to connect directly over the 3G network or 4G network, so it is transmitting instantaneously, which I think is sort of the way that the healthcare industry is going anyway.